So first of all, I'm a psychiatrist, which means I went to medical school along with the surgeons and other specialties, and then decided that I really liked human behavior and what makes our emotions influence the way that we behave and how we acknowledge those emotions. And I realized that, so why I'm introducing this is how I got into the field, because I wanted to know a little bit about myself and also my family growing up and how our responses to our environment, because of our identities as a Black person or as a queer person or as a woman, influenced how I felt and how I interacted with the public. And so racism was one of these things that I just was part of the discussion in our home from a very young age, which is why in addition to seeing patients, I also really like to create education and do workshops to help people understand how complex racism really is and how it impacts your brain and your behavior and what you can do to intervene, which is how I sort of got into creating videos and materials to help educate folks about the impact of racism on COVID-19 treatment, diagnosis, and also deaths, I would say, and then how that intersects with the rest of the healthcare system. So the first thing I want to just clear up is that we're talking about racism as a risk factor, not race. And so I think that, people probably heard this phrase that race is a social construct. So essentially it was a way to label different categories of people based on how they looked or their nationality or ethnicity or physically, right? But essentially created for a system to rank people in terms of a hierarchy of who is inferior and who is superior and how resources would be allocated. And so non-white people were, in terms of races, right, were essentially not given or didn't have as much access to resources when you think about the formation of our United States of America or England or, some of the countries in Africa and countries in Europe and how we've been colonized. And so that is really important to understand, is that we kind of talk about it like this fuzzy subject, but it's actually a lot deeper than that. It's entrenched, not just sort of in our attitudes and in the media and in our culture, right? It's something that we see on television shows or in music. We hear how people talk, but we also see it in our social systems, right? Like, so institutional racism. So we see it with the prison system. We see it in the residential system, in the real estate system, right? And we also see it in the educational system in terms of how policies are created that allow certain groups to have more resources than other groups. In this case, we're talking about race, right? But there are also other identities that resources are allocated towards, right? So in terms of citizenship is one, in terms of your, what first language do you speak, right? Where are you from and your immigration status? And then there's also one-on-one kind of personally mediated racism. So someone outright calls you a name, or someone directly tells you that they're not going to give you an XYZ job because of what you look like, or you realize that comes up in your conversation. So I think one thing to do is just stop thinking about this as a fuzzy kind of concept and just that it exists in our systems. Even if we don't know we're participating in it, we're all part of these systems as individuals. And so when I think about racism, right, and if we're going to get into the body and how it impacts our health, because we are seeing that numbers of Alaskan Native, American Indian, Black, and Latinx populations are more represented in terms of getting sick from COVID. So how is that the case? Problem is, there's not a ton of research that's super detailed that links what happens when you experience racism on a day-to-day with your brain and your body. But in terms of what we do have, I'll tell you a little bit more about that. So you're thinking about the brain, right? Let's start like way long ago when we were, our Neanderthal ancestors. When we saw a tiger, our bodies needed a system to get ready and fight. And that system is clearly stressful, right? But you need to get it activated if you're going to run from the tiger. So your brain gets more oxygen, your heart starts flowing faster, your bronchioles in your lungs will expand so you can let more oxygen in, your pupils dilate so you can see more light and see what's around you. And then your digestive system says it's not time to pee and poop right now. We need to conserve that energy. And so the way I like to think about the impact of racism is that for example, if I am anticipating giving a talk, let's say this was an audience of people who were much older and white men, and I'm using this as a stereotype of who we might think is in an academic community, I might be a little bit nervous about how I might be perceived because of my color or even my gender presentation. And so what will happen is that stress response might it gets activated. And that's inappropriate, right? That's not a tiger. It's just a group of dudes, a group of white dudes. So why is my body responding in this way? And it's because I've learned that maybe in other circumstances, something negative has happened. And I start to associate this with stress. And so what does this do to your brain and your body? So first of all, that response, to get all those different parts of your body to respond in this way, you need, chemical messengers. You probably heard of hormones or neurotransmitters. There's all this signaling that happens between parts of your brain to tell your body how to respond. And so one of them is cortisol, which is a hormone. We call it the stress hormone that essentially launches, much of this process. And so if it's called the stress hormone and we activate the stress hormone in events of racism when we're stressed, you can imagine that this stress gets really toxic, right? And what that does. And so when you're launching a stress response, you're trying to protect yourself and your body. And so if this is launched way too often, sometimes this response goes off when it's not supposed to, and things can get really dysregulated. And so that is one way in which we think about racism as a stress that impacts your body by continually activating the system that doesn't need to be activated. I think another way that researchers have been looking into is what happens when you're still in utero. So if you are, let's say, a Black mom who's pregnant and you are worried about racism, or depending on where you live, right? Maybe you don't have the right kind of grocery stores. You don't have prenatal care. So your baby's not getting all the nutrients that it should be getting. And on top of that, what happens is we're having the stress response. And so we've seen in children, and not just in children, but even years down the life stream, that this can impact the children's lives, like their life in general, their birth weight, how they respond to stress in general, and how many nutrients they have, especially during critical periods, right? People are pregnant talking trimesters or weeks. And that's because some of those time periods are much more important to have formation of body parts and organ systems than other times. I think another way research has shown is just when you think about the brain, right? We think about the primal kind of response when I'm talking about the running from the tiger. But then we also think about sort of how we can intellectually plan out if we're going to take a trip or if we're going to write a talk or something like this. And maybe that is more of the cortex, like the higher part of the brain. So we have the cortex. And I also think of it as that primal limbic system, which is like the emotional aspect. So what happens is when you see a tiger, your body processes that, and it's supposed to go to the primal system, which is supposed to activate you. And if it's not a tiger, if it's just a group of white dudes, my cortex is supposed to say, hey, calm down. You don't need to launch this response. So you can imagine if I'm continually launching this whole response over and over again, that these pathways probably get a little confused, and maybe one gets more activated than the other. And we know that the way the brain works is that neurons or brain cells that fire together usually work together, right? They're working on the same sort of response. And so the more and more and more I use that brain pathway, the more that gets reinforced and the less some of these other pathways get reinforced. And I'm less able to kind of intervene and stop myself from going down, that worrying that something's going to happen. And so imagine years and years and years and years, or days and days, or even if it's, I'll say 2020, right? Of this response happening, it disrupts homeostasis of our body, which is the way that our brain and our body communicates with each other to make sure that we're breathing, eating, getting all the nutrients we want in healthy amounts, right? I like to think about everything in moderation. Sometimes people want to know exactly, well, what is the exact pathway? How much % of this is dysregulated in that? And I would love to know that. The research, unfortunately, is not that clear. But I think about things in moderation, right? And once you start to get to the extreme of this is the system that you're continually activated, which also means, what if you're not activating it, right? That's not necessarily good as well. That you can cause disease by physiological disruption of the way your body is normally supposed to work. And so luckily, it's not just our genes and our body, right? It's also, we have our environment, which is the second part of how racism works. So I think you probably heard of this term, social determinants of health. Things like the education system, economic stability, your income, hospital access. So do you have a healthcare clinic near you, or do you even have insurance? Unfortunately, racism, again, we're talking about systemic racism, impacts access to those resources. So if you are a pregnant mother, do you have access to the resources to try to correct maybe some of the genetic predisposition or the stress that you might face with racism? Do you have other ways to kind of combat maybe some of the ways that your brain and your body is responding by accessing resources? And unfortunately, that's not necessarily the case. So I'm going to move us into COVID because I think we probably have to slow down some. But you think about COVID, I want you to think about people's pre-exposure, right? So we know that when people of color, mostly essential workers, so they're going into work. That's already one thing, right? That's a stress of knowing you have to go into work. Who knows what kind of experiences they're having there, if they're being talked down to, if they're experiencing racism, right? That's just a stress all on its own. They can't rest. And then more than likely, due to some of this stress response with cortisol and activating your body response, you probably have hypertension, coronary artery disease, or potentially even increased risk of diabetes, depending on what kind of grocery stores, how much you can walk, is there safe neighborhoods, what is your transportation like? So these things are all kind of really complicated, but I like to think about what are we even pre-COVID infection? What is the brain and the body and the environment we're working with, and how does racism impact that? So if you think about that pre-COVID, let's say you get sick with COVID, you need to stay home from work. Can you stay home from work? People who can stay home from work can afford to stay home from work, who might be more so, I think, a population of people who are more wealthy and probably white, because we know that most essential workers are people of color. And so that's already one way they're not able to actually get the full treatment. Then let's say you go to the hospital. Do you have a hospital that's adequately treating you? I know you guys have seen in the news that there was even a physician who was sick with COVID and hospitalized and didn't get the treatment that she needed. And although that is one example of racism, imagine that on a large scale of how resourced those health centers are. Do you even have a primary care doctor? Do you have insurance to go? And so treatment, how is that going to go, right? I don't know the specifics of what happens in every case, but then you can imagine how downstream, especially if you're coming in with some of these medical conditions, then you're trying to get treatment. And what happens then when things progress so quickly with COVID? And so I haven't even talked about education, right? Of knowing like the risks of what you shouldn't do. That's just a really quick overview. And I hope that was helpful. And I'm eager to answer questions, but that's the way that I think about racism as a risk factor for COVID-19 infection for people of color.
Thank you very much. It's really an interesting conversation. The maternal mortality for pregnant Black women is 3 times the rate of white women, irrespective of education, income, social status, which speaks directly to this issue of stress during pregnancy and causing disease as a result of racism. I try to explain that to one of my best friends, and his answer was, so are Black women more stressed? And to have to explain, how do you explain that to someone who doesn't recognize, the stress of racism? The fact that when you go to a store, you're going to be treated differently than the white person next to you, that the guard in the store is going to follow you, that the woman in the cosmetics department is not going to be running quickly to put makeup on you or put perfume on you. Those little things that happen on an everyday basis and that really just eat you on the inside.
So I was just going to tackle to that real quick, is the trauma we haven't talked about. Maybe you could talk about this, like when you have an actual traumatic event. We're just talking about regular things where it's just, you have that physiological response, stress response. But what if you have a traumatic event that's tied to a racist episode or something? How does that play a role, if you can speak on that, Tim?
So, and that's the thing. So if we think about COVID and 2020, is that trauma is a big hit to your system, especially if it's a physical trauma as well, because your body is trying to just get itself well. And then mentally you still have to cope with the fact that then you're going to walk back into the circumstances that might trigger the trauma. And so I would think about the way that I've been thinking about every time you mount the stress response. And my perceptive I think about this as I'm more of a big picture person. So just keep that in mind, as repeated instances of mounting that response. And that is not good for the body. So then imagine that you have one major response. It's a huge hit, depending on the extent of that trauma. That's really going to determine, how are you before that? What happens after that? Are you actually going to be able to heal, or are you exposed to that trauma again? And so I think about it in terms of repeated exposure. And I know trauma is a little bit complicated in my field because we think of PTSD as one incident, when more likely people have little traumas. I call them little T traumas all the time that don't necessarily get as much recognition. So it may not be little ones that you can get over, but then there might be a big one that is constantly kind of there that causes this hit. And I also think that for folks who may not understand what it's like to be discriminated against or the fear of racism, I believe in intersectionality. That's not to downplay what people of color experience, because it really depends on context. In the United States context is that people of color have been discriminated against. But there are some cases in which, Pablo, I don't know you very well, but I'm sure you are more than just your name and what you look like, right? You're maybe your father, maybe your brother, you're a newscaster, all of these identities, and some of them may be disenfranchised. So you might have a little snippet of what it might feel like to be a Black woman in that extreme. And so I think being able to talk about these issues, to talk about our identities, and also examining whiteness in the way that maybe you are part of the system, or at least you benefit, even if you are not intentionally doing so, right? It's just that you're white and that you don't have to deal with the additional stress. But I think it's hard. We don't have a lot of cross-racial friendships or communities. If you think about segregation, the way our neighborhoods and our schools are set up. So it's hard to have that conversation. It's also sensitive. This stuff is really hard to talk about. So how do you, talk about it in a way, I think, from Dr. Feldman's talk of not getting everybody so emotionally riled up in terms of this issue, but actually just to explain, not win somebody over. And we already know how complicated emotional processing can be, from what Kyrie mentioned, also just in terms of thinking about the brain and how those circuits are, you need to regulate them. And how often do you use them?
I think that when we're talking about COVID, the immune system is completely altered when you are in a state of stress. So, two people faced with the infection with the virus are going to react differently. And that's where you find people that have completely asymptomatic disease, and others can have completely severe, life-threatening infections.
Yeah, and that's the thing about COVID, is that we still don't know all the data, but I find it fascinating that me as a young, healthy person, there's still a greater risk that I can end up in the ICU, which is not something you generally think about, but the risk factors are very interesting in thinking about what contributes. But I also think it goes back to how the stress response impacts your body. So if you imagine that your heart is always getting racing, that your lungs are always dilating, and that your digestive system is turning on and off, what that does to your body. And so we do see higher rates of hypertension, coronary artery disease, which then makes it harder for your heart to respond to these pressure gradients and pump the blood that your body needs to get oxygen and nutrients to recover and to, combat something like COVID, or that you don't have fat inside your blood vessels so blood can actually get through, or even diabetes, right? You don't have sugar deposits or glucose deposits, on your neurons, on your cells, in your vessels, that are preventing your body to adequately respond. And so there are all sorts of interactions that prevent that response, along with then what you have in your environment or what you don't have in your environment, that can kind of help offset that.
We have a number of questions, Timmy, from the audience.
We do have a couple of questions. So the first question is, if race is a social construct, why is it used in medical decision making?
That's a really good question. And it's actually a big debate in medical decision making right now, is, do we need to take the race out of medicine? So the way that we're trained as doctors is, you see somebody and you write, when you're writing your note, this is a 36-year-old African-American woman. And so I think we use race because it typically, so how do we categorize people? Race is a construct to help us categorize people. And so all the research that's done on what kind of people get what kind of diseases, all the research that's done on who who's exposed to what kind of thing that might impact their disease down the line. So much of it is done by using the category of race. When you could maybe think about using zip code, you could think, think about occupation, but unfortunately, race is a social construct that is used really frequently. And I tend to be maybe in the middle of this conflict. And I think maybe because I'm an idealist and I believe that we don't necessarily, as humans and individuals, when we're talking about an entire group or population of people, you can't just assume they're all the same. So even if I've broadly been talking about people of color today, I know that that doesn't account for every single kind of people of color or person, right?
Yeah.
That there are cases you can't just assume that everybody has that. And that's one of the problems, what happens in medicine, is that when we use race, we kind of zero out all the other options, or it leads us down a path that maybe precludes other paths. And that's what's so harmful. So I think of it more as a debate that has to do with how do you think about populations and groups? And what is it maybe about this group, which might be race? Like, so what is it about Black people that we are specifically thinking about with respect to this disease? And maybe are there other markers that we could potentially be using? And unfortunately, this is a tough, complex conversation. Things don't change overnight. I will say the conversation's getting more louder is what I will say. So who knows how it will change, but you have to be able to allow for this nuance, which is sometimes hard in medical decision making. We use algorithms, we use like flow charts, right? Like if you see this, then that. And it's hard to do this. Are you dealing with is this a person who fulfills this kind of category or not? When it shouldn't be that way. Each person is presenting with a number of identities that, point you in different directions, but it's just the way that the medical field has been developed.
Yeah, there's a follow-up question. So is it too late to rectify the inequities in COVID policies and also in the healthcare system? So there's two questions. One was talking about, the COVID policies and treatments, and also in terms of caring for patients. How do you rectify that?
Or is it too late? I'll leave my opinion out of that one. I like to think that it's never too late, but I'm not necessarily optimistic. One thing I will say is that the Biden-Harris administration did create a task force, and they have one of my former colleagues, a New Englander, kind of like you all, who's at Yale, who's responsible for looking into equity of how we're diagnosing and how we're treating COVID. I think that's a positive sign, right? It's better than what we had before. So I'd like to, and at least we hear on the radio now, we're hearing how COVID is affecting populations of color. We're hearing how we're trying to get more vaccinations out. It's in the conversation. So I'd like to think that it's actually happening. So I will say that maybe I am a little bit more hopeful, is that at least we know where we're trying to get the vaccinations, but how are we going to do that? And I think that's the part that makes me not so optimistic. And maybe this goes to the downstream. Is it too late to change these things? Is that it's so complicated, right? So you could try to do things by race, but then there are three different, like we've already talked about, American Indian, Alaskan Native, Latinx, and Black. We can't just do things by race. We do things by income. We do things by English, by literacy, do things by citizenship. How do you start really helping each community in the ways that they might need that are separate based on their clustering, right? Which might be by race, but might also be by income. And what if some of those things are the same? And it's like the medical system, like every other bureaucratic institution, like the prison system, like the educational system, especially if it's public, moves pretty slow. And changes don't happen overnight. We in the 60s, we just got segregation, which is a desegregation, which has basically been undone. So how do you really make decisions that change that? And this is maybe personally, is that the amount of, at least being a physician, a psychiatrist who's trained in some of my institutions, is that it's hard when you are experiencing racism or sexism or homophobia, as on your day-to-day, and then to have hope that the system's going to change largely. So it depends on who's in charge and who's making these decisions and where money is going, which is a completely different conversation. I'm not going to get into capitalism, which, I'm not going to tell you my opinion on that, but we need money. We need money to build up the neighborhoods and the environment, right? If we're going to keep having these, if we're going to treat people a certain way based on race, like there's so many different aspects of where you could jump in. I think it takes money and attention.
I have a follow-up question to that. So let's just kind of focus on like the vaccine, how can we try to help with inequities in terms of how people are taking the vaccines? Like how can we try to start fixing that? That's one thing we can fix right away.
Yeah. So one aspect of the vaccination and this is where I think Dr. Feldman's research is really interesting, is like thinking about moral decision making, is the research that shows that for people of color who have been vaccinated, there are higher percentages of them who know someone else who was vaccinated. And so how do you tell people to get vaccinated? One, I think segregation is a huge issue, because if we have racial clustering and where we live, then maybe, and you're a population group that is not getting vaccinated so often, how do you get access to people who are getting vaccinated? How do you get access to people who can give you that psychoeducation? So I like to think a lot about medical clinics and the role of the physician. And that's just like a very kind of selfish focus, I suppose. But I think we need more community organizing. And that's not just like, that's the church. That's your primary care doctor. But what if you don't have a primary care doctor? What if your primary care doctor, you don't trust them, right? So then how do you get doctors into the community, or how do you get other representatives into the community that are trusted? And so it's really getting leaders from these communities who are able to go and sort of show that they're getting the vaccine and be able to answer those questions, or at least have someone who can help them answer those questions, which is another thing, right? Like I've been able to access the CDC website and look at the FDA results of the clinical trials, but not everybody's going on those websites. Not everybody listens to NPR every day. I mean, we're watching local news, or maybe we're going to work. So how do you get these answers to questions that people might have? And so at least I talk to my parents quite a bit, who were very different educationally. And so they've given me some really good material, which is why at least I've been trying to make videos. I've also started creating t-shirts that show that you're vaccinated. There's some phrases in Spanish. So I think really, highlighting and showcasing that you're vaccinated and that you're proud, to dispel whatever the misinformation or lack of information that might be happening on the other side, is one really good way, is phoning a friend and really getting out there and being active in your community.
Well, we're getting a shout out from the audience. Someone says, "Fantastic presentation, mind blown." So that's a good point. I wanted to just mention that Rhode Island and Alaska were the only two jurisdictions in the United States that brought the vaccine to high density communities on the first round of vaccinations. And it was a purposeful policy. I'm a member of the committee that made the decision, and we actually had a discussion about equity, about using social vulnerability index to determine where the vaccine should be going first, and to see the rest of the country, 6 months later, or 3 months later after the vaccine has been distributed, now thinking, we should be vaccinating communities of color that are at greater risk. That shows you how public policy is still not, up, even with the data that tells us that these communities are where the fire is burning most intensely.
Right. Well, good for Rhode Island. I've always been impressed with Rhode Island policy, especially mental health policy. So that makes me what made you guys do that? Why can't everyone else do it? Is it who's on the committee, who knew about the index, who was voicing, who the seat at the table, which then goes into, how do you get access? Talk about racism again. But I would love for something like that to happen in Maryland, and DC, and West Virginia, and Florida. My parents stood in line, they're over 65, and vaccines were gone immediately. And I know that there were some counties in Florida that went to mostly Republicans based on the governor's ideals. And so that's how these systems and these policies keep people disenfranchised. And we need more people like your committee that made this happen in Rhode Island.
Definitely so, and we're very proud of it. And unfortunately, I think we're running out of time. It's already 1:30. My God, time flies when you're having fun. Really, Callie, this has been a fantastic presentation. I'm so glad you could join us today and share your insights and your knowledge with all our audience.
Thank you for having me.
Thank you so much.